also Dr. Fogg, Dr. Polly Jan. Good morning. I'm Kelly, a registered nurse from HKBCF and also a recognized lymphedema therapist from Kaiser Smith method. Today I will share an update on current interventions for breast cancer and also lymphedema management, as well as our experience in HKBCF in supporting patients throughout their recovery journey. From our presentation, I will use bilingual, especially I will share more about our cases in Chinese, so I'd like to know more about our service. Just let you know our service in HKBCF. We founded since 2005 and with a vision to mitigate the threat of breast cancer in our community through education, patient support, research, and advocacy. Our missions are threefold: to raise awareness to breast health and early detection, to support through the treatment and recovery, and also to advocate for better breast cancer care in Hong Kong. We have three service centers, actually. At our BCF, we provide comprehensive and one-stop services for both breast health and also patient support. For the general public, just like Dr. Tan said, we have our breast health centers for public education programs and also clinical breast examinations through the mammography and also the ultrasound screening. As well as once the patient is diagnosed, we have the doctor consultations and also they will refer to our breast cancer support center. Once they reach to our breast cancer support center, or we have the inquiries from outside, we will provide counseling and support groups, also financial and free assistance program, lymphedema care services, survivorship program, and also the volunteer training and service for them. The comprehensive approach is holistic and professional-led to promote the message that early detection and saves lives. We focus not only on detection and treatment, but also have survivorship and overall quality of life to our breast cancer patients. We have also have many educations through our oncologists and also the psychologists. We have a series of video that listed in our official website. Let's see the breast cancer data in Hong Kong. Actually, today we have more than 5,000 number of cases diagnosed. That means each day we'll have 15 women diagnosed from the breast cancer. And as you can see, that, and you know that even from Dr. Tan's presentation, the number is quite huge amount, and also is increasing. And for the staging, as you can see, through the we promote the early detection and also the treatment. Most of them are diagnosed as stage 1, over 50%. And as you can see, the earlier they come to the treatment, the highest survival rate is more than 99%. Then what are those breast cancer treatments? The breast cancer treatments are multimodal through the surgery, chemotherapy, radiotherapy, and also hormonal therapy, and also targeted therapy. They have all the combination, and you can see with neoadjuvant or even adjuvant therapies to stage 0 to 3. And as you can see, the surgery is the key component in breast cancer treatment. Most of them know that we are encouraging if the early detection and the early treatment, they can undergo just breast conserving surgery. But with some condition that they still need to undergo the mastectomy. But they upon a necessary condition, they can even choose, or due to the condition, they may undergo the breast reconstruction. And for the treatments, actually, with our patients, we encourage them to do the curative interventions for those stage 0 to 3 with combination of adjuvant or neoadjuvant therapies. But we also know that once they diagnose for advanced stage 4, or even the disease progression, we change the approach with more palliative status. And throughout all the local and systemic treatments, those wound and scar or skin condition or the number of limbs dissected, the treatment option, a combination, and also the medical condition from that patient could affect the occurrence of breast cancer-related lymphedema. Now, we understand more about this. Lymphedema results from the dysfunction or damage to the lymphatic system, often caused by the lymph node removal by surgery, radiotherapy, or certain chemotherapy, such as taxanes. These lead to fluid accumulation in the interstitial tissues, causing the chronic swelling, usually in the arm, breast, or chest wall of that affected site. It can all occur. The obstruction actually leads the fluid staying outside the extracellular space, and as you can see, that can happen a few months or years during or after breast cancer treatments, and there is no cure for that lymphedema, and requires proper daily care, and that is good for good control. What's the symptom? These our patients are quite severe, and including heaviness, swelling, and also abnormal appearance to the affected limb. If the accumulation is not addressed early or properly, may lead to cellulitis, which requires more medical interventions, and later on in a series of lymphedema treatment for that. Let's see how some studies to show the occurrence of incidents. Actually, for some papers, as you can see, lymphedema can develop within 6 to 18 months post-surgery. We have around 33%. And sometimes the longer treatment they received, if they do not have the correct information or education for that lymphedema care, then it may happen even 10 years later. Our findings, we have more than 6,000 patients who received a measurement from or some service from us, and then we discovered that the first episode to occur since 2010, we have the data that is nearly 30%. That is quite much, and that's why we need more preventive and early detection methods to tell them. Then how our breast cancer support our care in HBCF? Not only we provide the survivorship or the care through after the diagnosis, and also when they have the primary treatment, we also promote more assessment and also follow-up case for them, so that to cope with the cancer and help them to live well. Our principle is survivor centers to enable them, engage them, and empower them. We integrate more cares through all our service levels, and our nurses will coordinate the care for them, and to promote and prevent, if the symptoms is coming out, then we promote them to manage that. And our centers provide patient-centered services for them to enable them to participate in the decision-making, and also to see their compliance, and motivate them to make positive health choice. And also we empower them to seek more information, not only to just live it as usual, but they need to know more information and exercise, so that to promote their quality of life. We also ensure that they should have their access in the right care at the right intensity and at the right time. That's why we promote them more information, but at the same time we alleviate them so that they won't drown with those information. We promote them bit by bit, and also we promote that at their time during their treatment. This This is our service pathway that from newly diagnosed breast cancer patient to when they finish major treatment to be as survivors. Once the patient is diagnosed, no matter it comes from our breast health center or even a referral from the doctor, and also they just phone in to seek the service, our nurses will actually to open a case file for them. And at first, we need to assess their condition, whether the stages, and also the need for them. If they need to go through more breast cancer treatments, we will arrange the treatment preparation for them. And also we have the peer support for them, and also if they need to have the support from the family members, we will also have the support group for the family. And also, we have more wound care and also the exercise, post-operative exercise for them to educate more about scar management and also the knowledge of lymphedema. If they need assistance program actually for the drug, then we can have several drug assistance programs that are arranged by our social workers. We hope all the step or the journey from them will be approached by multidisciplinary through the nurses, psychologists, and also oncologists. Our primary nursing care management throughout the cycle of assessment and also providing support, follow-up, and also the nursing advice. We concern and address their emotions, and then after that, we follow their condition through to see their choice of treatment options. If they undergo operation chemotherapy, we will also arrange some chemo talk for them to provide correct dietary advices, and also we have more exercise classes for them. And then after that, if they in between they have this difficult condition or they have questions, they're free to find their primary nurse. That's why we have the case progress. We can follow it throughout all her journey and also the road to recovery. Once they complete the major treatments, they are prone to the survivorship. Then lymphedema care is still need to maintain. And also once after they need to relieve their discomfort through the chemotherapy, then we will arrange our traditional Chinese medicine service for them. We have many therapeutic groups, such as talking about self-image, talking about when they need to resume work, and also they need to have better sleep. Most of them have the insomnia after that treatment or even from their stress. And also we arrange many mindfulness workshops for them. If they would like to be a peer to support other newly diagnosed patients, we will have training for them. That's why we promote them to do more volunteer service. For the lymphedema care support, actually we have we set up our protocols throughout many tailor-made measures and through the Counseling method. We promote the comprehensive support through early detection and prevention to postpone the occurrence of lymphedema through the complex and decongestive lymphatic therapy. We have many nurse care and advice during their breast cancer treatments, and also they are encouraged to do the lymphedema index measurement. As you can see, after their operation, they arrange to come to our post-operative classes to do more upper limb exercise. As you can see in the red circle, they have 2 patients that they need to step up their upper limb exercise because their range of motion is still limited. And we provide some tangible pillows for them to relieve the seroma and also the swelling during the along the axilla, so that to relieve their discomfort. We promote the lymphedema index measurement to let them know all the progress, whether they have a lymphedema condition or they are arousing the condition. After that, we promote the daily care and also for good control and maintenance. If they be after the treatments, we still need to see them and they still need to follow them for some time about scar management, skin care, the knowledge of prosthesis and bra for those using after underwent the mastectomy, and also the lymphedema prevention and also management. The picture you can see is the lady who underwent the mastectomy for many years. She still luckily not have the lymphedema, but also as you can see the scar is quite tender and hardening. We do many scar management on them through when do the lymphedema treatment, manual lymphatic drainage to her. And it needs to underwent at least 6 months to see this progress. And that's why good scar management can be promoted actually after the surgery. We will put it more step forward and to see, to let them know the importance of self-care. If she if she has the lymphedema, finally the occurrence of the first episode, we will try to manage it as soon as possible to minimize the episode of cellulitis. We have many exercise classes and we tell them to undergo the manual lymphatic drainage by self, or even if they need, our lymphedema therapists can arrange for them. They need to wear the compression sleeves and gloves, and also some treatment we may add on after the consultation for them. Now, we have 3 cases to share with you. It's quite remarkably showing how our breast cancer journey and how we support them. Then I will change to Chinese, just let you know more. 同大家分享咧有3個 case 啊，咁我哋其實喺 support patient 嘅時候咧，我哋每一次都會去同佢哋去講即係淋巴水腫咧要好好咁去預防。咁每個 patient 都唔係好即係第一下一定 first newly diagnosed 嚟我哋中心嘅。咁好似即係呢位方女士咁樣啦，咁其實佢自己咧喺美國已經做完手術，佢係 on and off 都要 travel from USA 同埋香港。咁佢嚟嘅時候咧，其實主要係因為佢做完手術，咁佢咧就嚟緊要做化療電療，所以佢先至嚟咁啱嚟，知道我哋服務就嚟我哋中心。佢係好 anxious on 佢嘅 treatment 係點樣嘅，所以當我哋 nurse 去俾 phone support 之後，亦都陸續同佢安排咧唔同嘅一啲 treatment preparation。咁我哋同佢哋去第一下，佢要去8月就進行化療啦。咁所以咧，我哋喺化療嘅期間，我哋就會話俾佢聽有啲咩須知，甚至中間咧喺唔同嘅 follow up 咧話俾佢聽佢嘅 condition 會唔會因為化療有啲唔舒服啦。咁之後咧，佢亦都 on and off 都會嚟我哋嘅 patient support group 去知道更加多啲師姐佢哋嘅經歷係點樣。中間我哋都會有啲 oncologist 咧係一啲嘅 section 俾佢哋去講解一啲治療須知嘅嘢，係啦。咁其實會逐步 relieve 到佢嘅 anxiety 嘅。其實佢整個過程都係好順利地落去咧，就係佢嘅電療啦，係啦。咁我哋中間 nurse 咧就係貫穿晒整個即係佢嘅時期，俾 assessment 亦都俾相應嘅 support 同埋 follow up 嘅。咁佢個 progress 咧其實佢就進行咗即係子杉上嘅化療啦，係啦，同埋咧就係電療咗15次，咁都係 stay 喺香港去進行嘅。咁23年完成咗咧，佢就開始咗佢嘅即係荷爾蒙治療啦，同埋佢都需要食口服標靶藥嘅。咁 on and off 佢都係要 travel 美國同埋香港。咁但係偏偏咧，同我哋 get along 咧，就發現咗佢自己發現咗咧，即係10個月之後咧，就出現咗淋巴水腫。咁所以就再嚟咧即係密啲嚟揾翻我哋，係啦。咁喺我哋中間，我哋其實都要話翻俾佢聽，可能係一啲oral 嘅標靶藥有啲乜嘢嘅護理啦，同埋咧都需要同佢咧其實有一啲唔同嘅 follow up。其實就按咧係 佢嘅淋巴水腫嘅 support 係點樣，同埋有啲乜嘢嘅 treatment 係啱佢嘅。佢咧，大家估下佢嚟度嘅水腫嘅時候係幾多度啊？嗱，我哋度水腫俗稱，但係腫咧就係大過10，即係嗰個指數大過10啦。大家有冇估唔估到佢？你估係雙位數定3位數？3位數之後嗰個，OK 係啦。咁佢咧就10個月後應該好少咁快出現3位數嘅。咁佢係雙位數33.3。咁所以當其時咧，同事啦，亦都即係我哋 multidisciplinary approach，nurse 做咗第一轉嘅assessment，然之後再轉介嘅情況咧，俾淋巴水腫治療師嘅。咁我哋發現咗其實佢見我哋嘅時候咧，其實佢已經原來佢個胸腔即係佢嘅 chest 嗰度其實係有一啲發炎嘅跡象。咁另外咧就其實比較硬實啦，係啦 tendering 嘅得 hardening 咧就係 over， 唔單止 chest 啦，其實 lateral chest 其實好明顯知得到佢咧其實係小狐狸個胸腔，但係手咧係就都有，但係咧就比較 soften 啲嘅。所以咧，其實我哋之後咧就俾一啲唔同嘅 nursing advice，有啲運動建議去做啦。咁同埋當然一定係減少佢嘅 inflammation 先嘅，因為越發炎得勁咧，其實都難去處理。咁然之後我哋都有唔止，即係每個星期佢翻嚟我哋中心咧，其實去做淋巴水腫嘅 drainage 啦。咁同埋咧，佢自己都買咗壓力手袖套去 comply 嘅。大家估下，我哋即係。我哋按佢嘅情況，因為佢都 travel 喺美國同香港啦，咁所以我哋咧就決定咗唔好咁密集去量度淋巴水腫啦。咁我哋3個月啦，冇辦法。咁3個月翻嚟咧，你估下佢跌咗幾多？又係估呢度33.3啊嘛，係啦。佢都幾 remarkably 咧，係接近一半，係啦，即係都佢只要 comply 得好，或者揾啱嗰個方法，其實佢 comply 得好。咁咧係啦，咁跟住咧就3個月，咁即係證明呢一個 management plan OK 啦。咁 OK 嘅時候，咁我哋又再睇下佢3個月後佢點樣咧，係啦。咁點知咧佢升翻上去22.7。咁當我哋 follow 翻佢，原來佢就係 travel 即係都比較頻密啊，唔單止即係佢探親啊，亦都佢嘅 lifestyle，總之佢係要周圍飛嘅。同埋咧，其實佢自己有好多其他活動咧，其實讓到佢自己去 manage 佢自己個 chest 係比較少，所以佢硬實嘅位又再多一啲。跟住之後咧，其實我哋都 adjust 咗一啲嘢㗎。其實佢自己去都發覺，如果佢難一啲，會唔會我哋加一啲嘅 padding 係讓到喺個 bra 裏面咧，讓到佢可以係即係就算唔係直係做運動或者自己去進行一啲按摩咧，都可以處理到咧。咁你哋又估下，我哋3個月後就即係3個月後，即係而家啦，即係11月度啦。你又估下佢最新去到幾多？有啲估係10幾啦，係嘛？咁啱咧，佢其實喺8月咧，佢停咗係啦，佢停咗佢個 oral target，所以佢最新咧係跌低過10。其實一個好 remarkable 嘅一個 progress 咧，俾到我哋見得到，其實我哋只要 engage 得好 ，manage 得好咧，亦都 empower 佢自己再做多一啲嘢咧，其實係一個 good control on 呢個 lymphoedema， 同埋將來佢哋都識得點樣去 maintain 好自己。同大家分享第二個 case 咧，就 Miss Zhang 咧，其實佢嚟揾我哋咧都唔係第一下嘅，係啦，佢其實第一下嚟已經係做緊化療，點知咧就有淋巴水腫。咁佢咧其實係即係70歲嘅女士啦。咁當其時 diagnose 咗咧係 stage 3咧，其實已經做咗 right mastectomy。咁佢係進行緊紫杉醇 Testosterone， 即係已經完成咗5-6針嘅情況之下咧，就發現咗淋巴水腫嘅。但係佢個電療係未做嘅，所以當其時嚟嘅時候咧，我哋同佢度淋巴水腫咧，我哋發現咗佢咧有61.4，係啦，俾大家睇下佢個狀況下。佢安息嘅時候咧，你會見到咧佢嘅 forearm 咧，其實係有啲應該呢度，你應該會見得到有少少紅㗎啦，已經泛紅啦。佢嘅手咧其實係比較脹實，佢嘅上臂咧係啦，都係你見到一個典型嘅淋巴水腫嘅例子。咁同樣因為佢係做緊化療期間，所以佢脹。所以咧，我哋information change 嘅嗰個 management 咧，我哋都真係要同佢講，喺呢個 moment 佢更加係唔可以進行繃帶或者係即係壓力手袖，佢點都要處理咗佢嘅炎症先。咁跟住之後咧， 佢呢個時候安車啦嘛，咁我哋嘅 management 俾佢咧，咁當然啦，即係當佢消咗炎之後，我哋先至可以進行一啲壓力治療啦。咁亦都真係教佢一定要 keep 住去做運動啦。咁喺嗰個 moment 咧，整個22年咧，差唔多年尾，咁就同佢處理呢件事啦。23年咧，我哋翻嚟再影相咧，睇嘅時候咧，俾大家睇下佢嘅硬實嘅位，特別係 forearm咧，其實明顯咧係好咗好多。跟住之後咧，7月嘅時候咁樣，23年9月咧，佢嘅手背咧，你見到已經好明顯係好唔同。只要佢 comply 得好咧，其實佢嗰個情況咧係 in progress 嘅。咁當然佢中間咧，其實即係一定係會有反覆啦。去到嗰個 moment 咧，嗱，整個 progress 你見到啦，你估下佢個淋巴水腫嘅指數咧，其實係點樣嘅？即係落去，即係點樣好轉法咧？其實俾大家睇下，佢其實由61.4去到而家最新6月咧，你見我哋咧係11.6，中間 on and off 咧，佢自己都有做運動啊，都有即係佢完成埋佢電療添啦。其實中間佢電療嘅 care 我哋都要特別好注意，就係唔會去因為咁樣而亦都再 trigger 佢嘅淋巴水腫嘅。但係你會見得到，當呢一個即係 care 上面即係 consistent 啲，同埋咧係會見得到明顯有啲 positive 嘅 impact。係啦，最尾頭先同大家分享咧，就話會唔會有即係3位數字嘅淋巴水腫係會有嘅。而咧我哋都會見得到咧，超過咗30年完成咗主要治療咧，電療後其實咧嗰個情況係點樣？77歲嘅余女士啦，其實咧就都有即係佢有2高啦 ，hypertension 同埋 hypercholesterol。咁其實佢亦都按緊 aspirin， 其實都已經係見得到佢當年90幾年已經即係做緊晒呢一啲嘅電療。但係咧越嚟越耐嘅時候咧，佢2016年咧就發覺隻手唔係好遞得到。當其時佢未認識我哋中心，但係又經即係朋友嘅介紹咧，佢知道原來呢度有得幫得到佢。咁佢嚟見我哋嘅時候咧，我哋係23年嘅，我哋第一下咧同佢度個指數咧係超過100嘅，係啦。咁124個樣係點咧？俾大家睇下，就係咁樣嘅樣嘅。咁你會見得到咧，佢係啲手指啦，係即係 deform 晒啦。佢隻左手係遞唔起，我諗重到遞唔起啦。再加埋佢都真係佢都有講過，以前醫生有講過電療咧係影響咗佢嘅即係nerve 或者佢其裡面就變咗更加越嚟越難啦。咁我哋同佢做 assessment 嘅時候，亦都見得到咧，其實佢即係都真係好 gross 嘅 Lymphoedema 係整隻手啦，亦都見得到即係難啲遞係啦，特別佢 forearm 嗰啲位置咧重到咧，佢自己要用右手去抬自己隻手係啦。咁個情況點咧？我哋即刻點樣做咧？其實咁梗係即係俾佢好密集嘅紮繃帶，佢冇發炎啦。你見到佢隻手都好靚。咁所以我哋紮嗰個時間咧，都係一個好關鍵。同埋佢要點樣自己 comply 咧？嗱，右手幫左手係容易啲嘅，係啦，左手幫右手梗係難啦。咁但係佢右手幫左手之餘咧，佢其實咧淋巴嘅熱自然淋巴引流 manual lymphatic drainage 係更加緊要。佢自己咧因為年紀大咧，其實佢同先生住咧，所以我哋係教埋佢先生點樣幫佢紮繃帶嘅，同埋點樣去做淋巴引流。跟住之後咧，呢個6月2號啦。咁呢個係佢自己學完紮繃帶嘅時候嗰個樣咧，就係去到6月嘅時候就起碼好似細咗啲喎，係啦，係咪燈光問題？唔好深究，但係你起碼見到啲手指咧，其實係已經有啲好轉啦。去到9月嘅時候咧，哇！我都聽到有啲話係啦，真係有啲話，我哋都有啲錯誤，其實係真係慢慢逐步處理到。去到10月咧，其實你見到佢嗰個 forearm 咧係真係好唔同，係啦，已經係輕咗好多。佢係好開心，因為佢從來都未試過，我20幾年隻手係叫做鬆翻啲啦，同埋冇咁個膊頭冇咁辛苦。佢個淋巴水腫指數係10月咧由124跌到剩翻20。其實呢個情況咧，我哋都見得到咧，佢係真係當然啦，佢先生係 support 佢好多，呢個係真嘅。即係有好多時咧，即係屋企得自己去面對嘅時候咧，特別有埋先生去認識呢件事咧，其實係一件都幾美好嘅事啊。咁我嚟俾大家睇下啦，你哋又估下，咁頭先講緊 sorry 啊，頭先講緊係23年10月啊嘛，佢跌到20啊嘛，咁去到而家中間發生咩事咧？有冇啲咩嘢唔同咧？係啊。 咁梗係有啦。我哋之後嗰步咧，其實係落到去 compliance 啊。其實佢可以點樣好好 comply？其實咧，佢最靚咧係23年12月，但係咧你見到24、25年咧，佢 on and off，我哋都唔需要度太密嘅。但係當佢嚟嘅時候，你見到會 fluctuate嘅。其實係因為佢嘅即係照顧者，即係佢嘅先生都要時間同佢擇啦，或者佢自己點樣去 comply？ 天氣熱會唔會差啲？係會嘅。而佢自己可以擇到 keep 到幾耐，繃帶嗰個嘅鬆緊度都關事。所以咧我哋都見得到其實 chronic 咧嘅 lymphedema 咧，其實慢慢 stabilize， 即係教翻啱嗰個 care 嗰個角度 tailor-made 俾佢咧。呢個就係我哋覺得係我哋即係 nursing care 上面咧係一個好重要嘅一個幾鼓舞嘅位，係啦。特別我自己都有聽過一個前輩講過啦。其實即係 nursing care 上面咧，除咗係 science 之外，亦都係一門藝術，都係一個即係一門藝術，係可以點樣個成就感就係點樣可以 through 呢一啲嘅 nursing care 點樣去 tailor-made 俾佢哋，讓到佢哋可以即係重拾翻呢一個即係好啲嘅 quality of life。In conclusion, our early detection in both breast cancer and also lymphedema is crucial, and also multidisciplinary and patient-centered care improve all the outcomes and ensure the better recovery. Through the education and continuous support and empower the patient towards the self-management to regain the quality of life. That's why actually I quite encourage you to support us also, because BCF continues to fill the service gap by providing these holistic and one-stop support for every breast cancer patients in Hong Kong. That's the